Hi, good evening. Steve Adler. Got a minute? All right, we're going to go through some numbers. We have better refined numbers. That just means the data's been cleaned up, so we're more confident in the numbers that we have. We're going to talk about our numbers. We're going to talk about bars. We're going to touch on City Council meeting tomorrow, Thursday, which is why we don't have Got a Minute at night. And we're going to take a quick trip around the world. But let's begin with the numbers here in Austin. This is our main dashboard. You can see number of admissions, 16. Again, still pretty flat. We were trying to get below 14 on a 7-day running average. We got up to 15. We're at 14. We're just kind of bouncing around at that place. Number of new cases today, one. In fact, that was yesterday's number, 14 and 16. The numbers, because we were late, because we were cleaning up the data. But the number of new cases and admissions today is 12, not 16 as you see. Those are yesterday's numbers. But today's news admissions are 14. The 7-day moving average is still 14. Again, it's just staying flat. Number of new cases today, 98. 98 new cases today. The 7-day moving average went from 77 that you see there yesterday up to 86 today. So bouncing around, maybe an increase in admissions, increase in cases. So let's talk about the number of people that we have in our hospitals. You might want to just stay on that page because the next page probably is yesterday's page 2. But tonight you can see here the number of people actually hospitalized in our city is 89 compared to 86, which is the 7-day running average. In our ICUs tonight, 35 compared to the 7-day running average, which is 30. The number of people we have on ventilators tonight is 21. 7-day moving average tonight is 20. So again, in each of these instances, the numbers we have tonight are a little bit higher than the numbers were for the 7-day running average, which means the numbers are headed up. So how is it that the cases are heading up, but we're staying flat on hospitalizations? The prediction and the thought associated with that, and what we're seeing from the numbers, is that we have older people that are getting infected. So they're showing up then in our hospitals. So even though the total number isn't moving up, the total number of people in our hospitals are reflecting again a little bit of an uptake in our older communities. When we take a look at those numbers, then the judge was given the opportunity by the governor to open up bars. You may have heard that he said he's not going to do that yet, wants to revisit it in 2 weeks. Both he and I got a recommendation on bar openings from Dr. Escott, who said that he had reviewed the governor's order. He said that while Travis County's been oscillating in terms of hospitalizations, the trend over the last 7 to 10 days, creates a concerning picture for the next month. The data related to hospitalized individuals, ICU, ventilators, all indicate an upward trend with the modeling. And then he repeated the numbers I gave you last night. 66% chance the infection is increasing, 55% increase in hospital bed use, 64% in ICU beds by November 1st is what the models show we could be dealing with. And then Dr. Escott mentioned that additionally, the beginning of the influenza season, the flu season, creates a second threat to the ability of the healthcare system to manage a surge. So he concluded with his recommendation by saying that it's important to identify avenues for our business community to be able to reopen and thrive. We have to continue to prioritize the health and safety of the community and our ability to ensure that our schools can successfully stay open for in-person learning. Therefore, it's my recommendation that bars and similar establishments be prohibited from opening at this time, but that we reevaluate the risks associated with bar reopening following the collection of data for another 14 days. The governor today himself commented again about bar openings, said that he was also going to be looking at the data to see if he should change his order in 14 days, which I imagine would be a consideration of taking the discretion away from the local county judges and instead just going ahead and opening them. For your information, Austin not opening bars today, same thing in San Antonio, same thing in Houston, same thing in Dallas, same thing in El Paso. Part of the reason is just trying to figure out how it is that we do bars, if we do bars in a way that is safe. Can we open bars and have everybody sitting? Like in restaurants, if you're eating and drinking, masking everywhere in the bar, in the restaurant, unless you're actively eating and drinking at the table. Can we make it so that people don't mill around the bar and congregate around bars, that it's just a table service? Can we open bars, maybe put in music so that people can play and people will go to the bars? Can we do that without dancing, which has that additional physical contact? Could we encourage music to be played outside and maybe relax our noise restrictions in the city? So we're taking a look at different ways to do that because we obviously want to do it in a way that's safe. This weekend, not a football weekend, I want to show you a picture of what East 6th Street looked like between Congress and I-35. You can see we already have big groups that are gathering. So part of figuring out how to open up bars is going to be to figure out what do we do with people outside while they're queuing. I would hate for us not to be able to open up bars because people outside waiting to get in are all lumped together and aggregating and creating the kind of groups that we don't want to see. So we'll be working we reached out to the chamber today so we can work with the businesses. We can say, hey, is there a way for us to be able to do this that lets businesses open, but still at the same time keeps the community safe? Taking a quick tour around the World Health Organization emphasized today that most transmissions for COVID-19 around the world are happening in households. We're seeing that too. Most of the cases that we see are not person to person at school or at work or out somewhere, although that happens. What we're seeing pretty constantly, as you might imagine, is that person then goes home and then infects the people that are in their home. The top World Health Organization today, talking about the issuance of vaccines all around the world, says that healthy young people are going to be the last probably to get the vaccine around the world, and that some might not get that till the very end of next calendar year, early in 2022. There are a lot of people in the world to get vaccines. The estimate in our country is that there might actually be some vaccine that starts getting out in January, February, maybe, to first responders, to the people that are most at risk, and then enlarging as we get closer to the summer with more vaccines available. Nobody really knows for sure yet. We still need a lot of things to go right in the testing. New York Governor Andrew Cuomo threatened to withhold state funds from local governments that didn't enforce shutdowns on schools and restrictions on gathering. Just goes to show what happens at the state level depends on what state you're in. Different governors in different states acting differently. Northern Ireland, which had gotten their numbers real low, just announced a 4-week lockdown because the numbers spiked and they couldn't stop it in time. Wales was banning travelers from other spots, even in England, Scotland, and Northern Ireland from high coronavirus hotspots. Bars and restaurants in Catalonia, region of Spain, closing for 2 weeks as a countermeasure to what they were seeing. Portuguese Prime Minister announced the country is going to enter a state of calamity midnight Wednesday. He says they need to get really serious about what's happening to them. France declared a public state of emergency. Cities, including the Paris region, people are confined to their homes between 9 p.m. at night and 6 a.m. YouTube has said that they're going to remove any videos that contradict expert consensus on COVID-19. So we're not alone. This is happening all over the world. Everybody is trying to figure out what's the right balance between opening up people's lives and the economy and trying to keep people safe so there's not a run on the ICUs and on the hospital space that's available. Thursday is council day. We're going to have our council meeting tomorrow. We're going to be authorizing the purchase of conservation easements on 550 acres that to protect water quality in the city. Core value here in Austin. We're going to be approving vision plans for Watery Long Metro Park, which is a park in East Austin, several times larger than Zilker Park here in downtown area. Also going to approve the vision plan for Johnny Trevino Park, and I miss him. 60, and we're going to also have some more money that is being designated and earmarked for emergency food access in the city. We're going to move forward with the SAVES resolution, which is getting $5 million for some of our civic infrastructure that if we lose will be difficult to ever replace. That's childcare getting $5 million, live music venue preservation, $5 million, legacy business relief grants, another $5 million. A lot of those will probably be our iconic music venues. And then there's an IFC. Many people on the council are working toward to honor Ruth Bader Ginsburg, honor her life and legacy. Council will probably ask that her final wish be honored. Hey, yesterday, over 1 million people voted in Texas for the first day of early voting. As of 5:15 p.m. today, more than 33,000 people had voted in Travis County today. That's in addition to the 58,000 people that voted yesterday, either early voting or in accumulated mail ballots or in handing their ballots in. I think about 36,000 people voted in person yesterday. And again, at 5:15 today, we were at 33,000 people, lots of locations. You can go to the website that the county has, and it'll tell you which voting locations. At votetexas.gov is the state one. There's also a county website that you can go to that will you can look at it, and it'll tell you with a green icon or a yellow icon or an orange icon. You go to, let's see, where is it? TravisCountyTexas.gov/elections/current election. You can get to that site, but you can go and see whether a voting location has a lot of people there or whether it's marked in green, and you can go hopefully without any lines. Hey, you can go vote early any day through November 30th. And it's important to know that some restaurants are giving freebies or discounts. It's absolute joy having voted, but a little bit nicer if you can get something from Home Slice, or you get some queso at El Chilito or Galaxy Cafe. I think that Joe's Bakery is giving a discount to people that are voting. So there's lots of opportunities and lots of ways to make it real enjoyable. I'm going to conclude by sharing with you something that I got. Some children at St. George's Episcopal School made some cards and some posters to share with local nursing homes for World Smile Day on October 2nd. An awfully nice thing for them to have done. With that, I'm going to wish you all a good night. You stay safe. No, got a minute tomorrow because of the city council meeting, but I'll talk to you again on Friday.